From Norwich in the east to Leeds in the north, outside hospitals right across England, at 8 a.m. the picket lines formed as junior doctors began their first strike in 40 years.
The majority of people realise why we're doing it. They realise that we want to protect our NHS so that future generations can also benefit from such a wonderful service.
I can see the strain that's already on the system at the moment. Recruitment issues, gaps in the rota, heavy reliance on locums, and the new contract is just going to make all of that worse.
At Milton Keynes Hospital, where the outpatients clinic ran as normal, patients we spoke to expressed support for the strike.
It's a good idea to have, I guess, happy and not too tired doctors doing the work.
They work long hours, and what would we do without them?
Junior doctors are providing emergency cover only for 24 hours until 8 a.m. tomorrow. 3,500 treatments have been postponed. That's around a quarter of the hospital work done daily in England, and it includes 1,300 inpatient operations and procedures that had been planned for today.
It's not acceptable to have mortality rates at the weekend that are 11 to 15% higher, and we want the NHS to offer the safest and best care in the world. And we all have that in common, so the right thing to do is to talk, not do what we're seeing today, which is put patients at risk.
Save our NHS!
At one hospital, Sandwell in the West Midlands, junior doctors reacted angrily after managers attempted to summon the workforce back in by declaring a major incident.
They sent an email out at 8:15 this morning asking us to come back in, not telephoning us like they said they would. At the moment, the clinical incident is an internal capacity issue.
But on the whole, hospitals have coped.
I think we might need to start doing a social work referral, Tessa.
Back in Milton Keynes, staff on Ward 14 held their daily meeting as usual, with the consultant covering for her striking junior colleague.
I think it's important to point out that this is not a dispute between the hospital and its junior doctors. It's a dispute between the British Medical Association and the Department of Health. And we, like all hospitals in England, are hoping that they will bring it to a speedy end so that we can get back to business as usual.
This has been a show of strength by England's junior doctors. Huge efforts have been made today to minimise the effect, but ultimately it is patients who felt the impact.
You're welcome.
Catherine Jones, 5 News.